Senate Republican leadership on Thursday released revised language for the GOP health bill to repeal and replace large portions of the 2010 healthcare law. Some of the more major changes that were in that bill is additional funding to the State Stability Fund, which will help states lower premium costs and other healthcare costs for state residents, individuals who are enrolled in the individual market in those states. It would also add about $45 billion in funding to help with the opioid crisis. This was a major ask of some moderate lawmakers like Senator Portman of Ohio and Senator Capito of West Virginia. What the bill did not do is change any of the proposed cuts to Medicaid. In the original bill, the law's Medicaid expansion would be phased out by 2024, and in 2025, a more strict growth rate would be placed onto the entitlement program. That's been a major source of pushback for moderate lawmakers, and even just now, you saw about 5 lawmakers who have expressed serious concerns about those provisions huddling with Senate Majority Leader Mitch McConnell, as well as the Center for Medicare and Medicaid Services Administrator Seema Verma, to discuss those concerns and try to come to a solution. There's a number of options on the table to try to bridge the gap and the concerns that those individuals have. It remains to be seen whether McConnell will be able to bring those senators on board. There's already been 2 lawmakers who have come out opposed to the measure and said that they would vote against a procedural motion that would allow the chamber to bring up the measure. If one more senator were to come out in opposition to that, assuming that no Democrats are going to support this, he would not be able to then advance that, and the bill would die when that vote is held, probably next Tuesday or Wednesday. A big key point for a lot of these lawmakers will be the score from the Congressional Budget Office. That's supposed to be released Monday evening, is the best estimate folks have, and that'll give a good lens into what these changes will do. The previous score said that about 22 million people could lose health insurance under the GOP plan. So that'll be a major thing that those hesitant lawmakers look for when determining whether or not this is a measure that they will end up supporting.